There's a ton of opportunity in being at Zucker Hillside Hospital.
This program is so unique and so different from other programs.
People who train here really appreciate the culture and the environment.
The thing that really sold me on the program was the diversity of experience that fellows have here.
And being in a community that's connected to New York City.
I am Dr. Consuelo Chichi Kagandi. I am the chief for the Child and Adolescent Psychiatry Division here at Zucker Hillside Hospital. And as program director, I also oversee the fellowship program where we train child and adolescent psychiatry fellows. Our fellowship program is within two centers, Cohen Children's Medical Center and Zucker Hillside Hospital.
Zucker Hillside Hospital has a long tradition of nearly 100 years of providing mental health care for the community. The child psychiatry program here developed almost 70 years ago, first with adolescent inpatient work, outpatient work, and then providing consultation to pediatrics, even before the Children's Hospital opened in 1983.
We are one of the largest programs in the country. We have 20 fellows, 10 per year.
We have a broad range of faculty who work in each of our clinical settings.
Our faculty are so supportive, so smart, so innovative.
The faculty here, I would say, is very diverse, and that's also kind of one of the things that drew me to this program.
Any given day, it's exciting because I get to work with psychiatrists, child and adolescent psychiatrists. We get to work with psychologists.
One of the biggest drawing points for me was the culture of the program.
The culture is wonderful. Everybody is warm, caring, kind, compassionate. We lift each other up.
It's almost like a family. We really take care of each other. We support each other.
I came in expecting to learn a lot. I think what I was not expecting was to have so many mentors who are excited to teach, who are excited to share their experience with us.
Fellows really experience a variety of different kinds of rotations, are exposed to a variety of different kinds of settings and patients.
The continuity clinic is critical, and to be outstanding child and adolescent psychiatrists, we really feel like it's important that fellows start seeing patients in the outpatient setting right in their first year. They're going to be having a small caseload. They'll be learning to do intake appointments under direct supervision of an attending who's going to be observing them to make sure that they get their diagnostic interviews down pat, they get their formulations down, and they really get to discuss a comprehensive treatment plan with an expert in the room. We have our inpatient unit, which sees children from about 13 to 17 years old, where fellows spend 10 weeks there. We have an intensive day treatment program, where fellows spend another 10 weeks. We have an eating disorders program, where fellows rotate for at least 5 weeks. We have a busy consultation liaison program, where fellows spend another 5 weeks. We have opportunities called the minis, where fellows work in developmental pediatrics. We're going to have fellows go to an autism specialty center called Proud Moments, where they learn about ABA, Applied Behavioral Analysis. We have a really comprehensive emergency room center.
The emergency rotation here is very varied and diverse. We had nearly 5,000 visits last year.
I'm really proud of the opportunities that I've had here in the emergency department and help children when they're coming in with their most acute needs.
During the second year, it's all outpatient. They're going to see a whole range of psychopathology, everything from depression, anxiety, psychosis, trauma.
My most rewarding experience here has been in the outpatient department, being able to meet a child and their family and work with them throughout the year, and then also watch them grow.
It's a privilege to have an opportunity to let these families and these kids into their lives and try to figure out a way to shift the trajectory so that they can make a life for themselves and make meaning.
We also provide a strong education foundation through our curriculum and didactics.
The seminar series is once a week, and this year we're really excited because we're going to be doing it based on psychopathology, but through a developmental lens. So for instance, we're going to be thinking about how anxiety disorders present in this young child, in the school-age child, and in children and adolescents.
Our faculty come from diverse backgrounds, which I think provides a lot of rich experiences for our trainees.
We're very lucky to have a wide variety of different professionals here, psychology, social work. The community is very diverse.
Queens County being one of the 5 boroughs of New York City and the most diverse county in America. There are nearly 100 languages. You'll see every diagnostic group, every cultural group, and the whole range of socioeconomics. So you'll see really every possible clinical experience, and it makes the clinical training program so meaningful and so robust.
So I'm really excited about the Pathways to Expertise program in Child and Adolescent Psychiatry. Most people come with a passion, with an area of interest that they really want to explore. We give fellows the unique opportunity, protected time to really pursue that passion. It could be something like teaching, education, working with a specialized kind of population. Whatever you are interested in, you have protected time to work on it with mentored supervision. And at the end, we're really hoping that you'll share and deliver what you learned and became an expert on.
We have fellows who present at national conferences, especially at the American Academy of Child and Adolescent Psychiatry. And we also require them to do grand rounds, present a topic of their interest or research project that they've done all year. The other opportunity is that our fellows teach.
In the program, we certainly have a very large emphasis on wellness as well, and the balance between clinical, theoretical knowledge, and also just being able to live a life outside of work, which is so important. To be able to experience New York City and all of the exciting things there are to do here.
You know, whenever you do need a break, you're able to take a wellness day, which I think is important as well.
Our co-fellows, we're all very close. We, go for dinners, making sure that we're taking care of ourselves as well as the kids and the patients that we're here to take care of.
Child and adolescent psychiatry as a field is so important and growing so fast.
And it's the #1 physician shortage area in the world right now.
I wanted to be a part of the group of people who are helping fill that gap.
Being able to work with children is an incredible privilege. I think I'm constantly surprised in psychiatry by our patients, how resilient they are, how funny they are. And I think being able to give holistic, compassionate care has been really rewarding for me.
The ideal candidate for a fellow has to be somebody who's motivated. I think having a good sense of humor is great, and they have to be passionate themselves.
I think the qualities in a fellow interested in this program would be just a willingness to learn, a willingness to adapt to the different scenarios and environments, rotations that they'll find themselves in.
I would love a fellow who's curious, not afraid to ask questions, loves to learn, enthusiastic.
Our program really values fellows that are compassionate first and foremost, who have a desire to really truly help a vulnerable population of kids that we're working with.
And someone who is inquisitive and someone who is collaborative.
I would highly recommend Zucker for your Child and Adolescent Psychiatry Fellowship.
It's unique. It has things that a lot of other programs don't.
Having the opportunity to train the next generation is the most gratifying part.
Fellows will be outstanding clinicians, they'll be outstanding leaders, they'll be outstanding at looking at the literature and doing evidence-based medicine. But also there's a mission to do better for our communities.
I truly do feel like I'm able to make a difference in people's lives.
Kids are facing different challenges at an unprecedented rate. Now more than ever, as child and adolescent psychiatrists, we have the ability to provide care, support that can really change the course of someone's life.